talk about the management of diabetic ketoacidosis in pregnancy, which is precisely this entire table in the TOG article. So, this is very, very easy to remember. We will do it in a few parts so that we can by heart it once and forever. Now, the first and the most important aspect of management of diabetic ketoacidosis is IV fluid replacement, because we've all known that dehydration has been a very, very big problem in DKA. So, we have to dilute the body, we have to give IV fluid first, and then think about the other things, about the insulin, potassium, and all of that. We will do it according to the reports, but the moment we diagnose the patient, first thing before we get the potassium levels and everything, first thing is we have to start the patient on 0.9% normal saline. So NS is our first and the best friend. Okay, now to understand the fluid therapy in DKA, we have to think of a birthday party. Now, this is a very, very wonderful birthday party going on, and in the first hour of the birthday party, we have so many guests. So, in the first hour, we all know first come, first served basis. Okay. So, in the first hour of the birthday party, we will be giving the major chunk of the birthday cake. So, these people, they had come in the first hour and they have taken a major chunk of the birthday cake. Now, how much they are taking? This is very, very easy to calculate if we remember that it is the 15th birthday. That means what? We will give them cake at the rate of 15 ml per kg per hour in the first hour. Okay. So 15 ml per kg is what we have to remember. We can remember the 15th birthday, and in the first hour of the birthday, this 15 ml per kg per hour is what we are giving away. The major chunk of the cake is taken in the first hour, because we know diabetic ketoacidosis is an emergency, so we have to drastically manage it. So in the first hour, we will give a lot of cake, almost a major chunk of the cake. We will give it in the very first hour. Now, after some time, in all birthday parties, we know that some guests will again turn up. Okay, they will say, I had work and I was busy with some meetings. So, some people will again keep coming in the next 4 hours. Now, they have to also be given something, isn't it? So, we will think that, okay, we will give them 50% of what we had given in the first hour. So, this is 50% of what we had given in the first hour. So, suppose if we had given 1, I know liter is not the right unit, but since we will compare it to NS, let's make it liters. So, if we had given 1 liter of cake in the first hour, 50% of that 1 liter, that is 500 ml, we will have to give to the new guests in the next 4 hours. Okay, because we have to save some amount of cake for the next guests also. Now, there are always some more lazy people who will say, I'm sorry, I'm late, I'm so late. They keep coming. Okay, now these people, lazy people, they'll keep coming for hours and hours and hours and hours. So for the next 8 hours, we have people, they will keep coming. Now the person who is in charge of distribution of the cake, he's getting worried that if I give away the entire cake, I'll not be left with anything. So in the next 8 hours, he will again make it 50% of what he had given in the last 4 hours. So now he makes it 250 in the next 8 hours, because he has to save some cakes. See, people are keeping to come and they keep coming and asking, so he's reducing the amount. Initially he gave a big bite of 1 liter in the first hour, but next 4 hours people kept coming, so he gave half of the first bulk in the 4 hours. Now again people are coming for the next 8 hours. They are coming, so he's giving off half of what he had given in the last 4 hours. That is this chunk. Okay, so now the first hour is gone, the next 4 hours are gone, and 8 hours are again gone. So after 13 hours, very less amount of people will come. Okay, so next what he will do is this half of this, that is somewhere around 150. Yes, it is a little more than half of this, but then what he will do is he will give half of this in the next few hours, whosoever comes. Okay, but till what time does this distribution of cake will continue? Isn't it? See, we cannot let the birthday party continue for 3-4 days, isn't it? So we have to put a cap that now it's too much time, we are running out of the cake, we cannot give you any more cake, so we have to find a resolution for that. So when we see that the cake is very little and we have around 14 guests still remaining, okay, now we have very little cake, isn't it? So now when the guests are somewhere around 14, what we do is we start adding chocolates because we have little cake. So we will add chocolates. And what is this chocolate? This is dextrose. So when the blood glucose drops to less than 14 millimoles per liter, we will add chocolates. Okay, that is to prevent sudden hypoglycemia. We have to give dextrose, that is 10% dextrose. See, the name of the chocolate is 10. Okay, this is 10. Chocolate's name is 10. 10 rupees chocolates, they are so easily available. Almost every child who asks their parents to get them chocolates, parent will buy 10 rupee chocolate only, because chocolates, too much of chocolate is not something we want our kids to have. So 10 rupee chocolate is relatively safe. Okay, so 10 rupee chocolate, that is 10% dextrose, is added to be given to the guests along with this little amount of cake which is being served. That is, IV fluid is given along with dextrose 10% when the blood sugar is less than 14 millimoles per liter. And what is the rate of transfusion? That we have to remember, that is 125 ml per hour. This is something that we have to remember as the rate at which we have to give 10% dextrose. See, chocolate, you cannot give the child to have too many chocolates. You have 10 rupee chocolate and keep having. You have to control the rate at which the child takes chocolate, isn't it? Otherwise the child will have so much problem, tooth decay and all of that. So at a rate of 125 ml per hour, at this controlled rate, we will give the child these 10 rupee chocolates, that is 10% dextrose, which is to be given to the guests along with the cake that we were giving, because now It's been a very long time, after maybe 13-14 hours, and still we have 14 less than 14 guests. That is, blood glucose is less than 14 millimoles per liter, so the glucose is relatively controlled now. The guests are relatively controlled. So with little bit of cake, we will give them 10 rupee chocolates, rupees 10 chocolates, and not very fast, because these guests are kids, so we will give them at a controlled rate of 125 ml per hour. So the points which we have to remember is that the guests that we have, first they will come in 1 hour and they get a very big chunk. Then next 4 hours we keep observing them and we give them 50% of the last chunk. Next again 8 hours, slowly they keep coming. So we again give them 50% of the last chunk, and after that we give them even less than 50, almost 50%. If this was 1 liter, this is 500, this is 250, and this is 150 ml per hour after 8 hours. Okay, after this duration, this is the first hour, then this is the next 4, then this is the next 8. So 8 plus 4, 12. After 13 hours we will give at almost this rate. And we have to remember, when the guests are less than 14, that is equal to the glucose is less than 14 millimoles per liter, we have to give cake with rupee 10 chocolates, but not very fast, so that the children, they don't get sugar, at the rate of 125 ml per hour. This is the rate at which you have to give the 10% dextrose. So in nutshell, this is the very important fluid management for the management of diabetic ketoacidosis. This is a must in exams, this is a must everywhere, and especially in clinical practice. Anybody, even a layman who doesn't know anything about the management, if you know how to give fluids, at least you'll be able to save the patient. So I cannot impress upon this how important it is enough, because fluid management is so important, and this is so easy. You just have to keep making it half, and when the target is relatively achieved, we have to add chocolates to the cake. That is, this little small thing is the only thing that we have to remember for the fluid management of diabetic ketoacidosis. Please write in the comments if I can simplify it further, so that you can get a very crisp and easy understanding of fluid management in DK. Thank you.